Title: The current health issues in Pakistan. Health is the foundation of a nation's progress, yet Pakistan continues to struggle with several pressing health challenges. Despite efforts by both government and private sectors, the healthcare system in Pakistan remains under severe pressure due to poor infrastructure, inadequate funding, and growing population demands. 1. Infectious and communicable diseases. Pakistan faces a high burden of infectious diseases such as tuberculosis, TB, hepatitis B and C, HIV/AIDS, malaria, and dengue fever. Each year, thousands of new cases are reported, putting immense strain on the healthcare system. Polio, though nearly eradicated worldwide, still persists in some areas of Pakistan due to vaccine hesitancy, misinformation, and difficult access to remote regions. 2. Malnutrition and food insecurity. Malnutrition is one of the most serious health concerns in Pakistan, particularly among children and women. According to UNICEF reports, a significant percentage of children suffer from stunting, wasting, and underweight conditions. Poor dietary habits, poverty, and lack of awareness about nutrition contribute to this crisis. Women, especially in rural areas, face anemia and vitamin deficiencies, which impact both maternal and child health. 3. Non-communicable diseases, NCDs. While infectious diseases dominate headlines, non-communicable diseases like diabetes, hypertension, heart disease, and cancer are quietly becoming more common. Urbanization, sedentary lifestyles, and unhealthy eating patterns are increasing these conditions. Unfortunately, preventive healthcare and early diagnosis systems are weak, leading to late detection and poor management of these chronic illnesses. 4. Mental health crisis. Mental health is a growing but often ignored issue in Pakistan. Depression, anxiety, and stress disorders are rising due to economic hardships, unemployment, and social pressures. Yet, mental health services are limited, and stigma prevents people from seeking help. There are very few trained psychiatrists and counselors available, especially in rural areas. 6. Healthcare infrastructure and accessibility. Pakistan's healthcare infrastructure is unevenly distributed. Major cities have better hospitals and private facilities, but rural areas, where most of the population lives, lack even basic health units. Shortage of doctors, nurses, and essential medicines adds to the problem. Public hospitals are overcrowded, and the cost of private healthcare is unaffordable for many families. 7. Environmental and sanitation issues. Environmental pollution, unsafe drinking water, and poor sanitation contribute to many health problems such as diarrhea, cholera, and respiratory illnesses. Urban air pollution, driven by traffic and industrial emissions, is also linked to rising lung diseases and allergies. 8. Government policies and the way forward. The government has introduced initiatives such as the Sehat Sahulat program, expanded program on immunization, API, and National Health Vision 2025. While these are steps in the right direction, proper implementation, accountability, and increased funding are essential. More focus on preventive healthcare, health education, and rural medical services is needed to build a stronger health system. Conclusion: the health issues in Pakistan reflect a mix of poverty, lack of awareness, and systemic neglect. To ensure a healthier future, the country must invest in public health education, disease prevention, healthcare accessibility, and nutrition awareness. A strong and inclusive healthcare system is not just a necessity, it is a national priority for sustainable development. 5. Maternal and child health. Maternal mortality rates remain high in Pakistan. Many women lack access to skilled birth attendants, proper prenatal care, and emergency obstetric services. Rural and tribal regions are the most affected, where cultural barriers and lack of transportation further complicate matters. Similarly, child mortality is linked to poor sanitation, unsafe water, and inadequate vaccination coverage.